We have protocol, we have hardware, but mostly we have great people. We have nurses and therapists who are dedicated and wonderful and experienced and really can help work with people. We have full multidisciplinary therapy, so many patients will have the full collection of physical therapy, occupational therapy, speech therapy, respiratory, and nursing, caring for them and working them back gradually to health.
At Barlow Respiratory Hospital, we're specialized for our weaning protocol, and also we are specialized in Passemeter valve, which actually most of the hospitals probably not even familiar with. Passemeter valve is something that would help us on a patient, even on a ventilator, patient would be able to talk. And also sometimes at a point they can eat as well too. Mike came from another hospital, was completely event dependent.
I had no clue what was in store for me. I didn't have any hope leaving the hospital that I was at to going to Barlow because I had nothing. I mean, I was hoping that a miracle would happen.
I think Mike came to the right place. It's a respiratory hospital, and the whole focus is on taking him off the machine.
We placed him on our weaning protocol. He was placed on a Passemeter valve. He was completely decannulated. By the time he left the hospital, he was up to pretty much to his normal state.
This is a relatively recent development in the last decade or two. It's called a Passemeter valve, and it allows us to hook you up to a trach, still sometimes even on the ventilator, and it allows you to be able to begin to talk, and then if you're strong enough to begin to swallow. So as we're doing the weaning and you're advancing off the machine, but you still have the tracheostomy in place, we can begin to work with people on talking and then eating, two major league functions in both physical and psychic recovery.
But I was there for, I think, 3 or 4 weeks, and it was a miracle, you know? I mean, I'm blessed to be there and to be part of the Barlow, and the treatment that I received there was awesome.
When he came back with his wife and just walked down the hall and started giving hugs to my employees, and he was able to talk, that made us really proud of the work we do. So every patient comes from different walks of life, and we have to make sure that we are able to meet their needs, and with all the education and the orientation we provide, be able to do that here at Barlow.
I did medicine because I could make a difference in patients' life.
It feels great to see somebody who comes totally dependent on a vent and to see them walk out of a hospital. And I think all the hard work when you see a patient leave like that is paid off.
It's a great pleasure to come here every day and continue to help improve quality of lives of people who need our assistance.
Thank you, Barlow.
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 Thank you, Barlow.